of Jackson. I am Sydney. I'm going to be your nurse. I am Sydney Sagers. This is my patient, Jackson. I'm going to do a head-to-toe assessment on you. I'm going to start by assessing your olfactory, your cranial nerves, and then I'm going to assess balance, and then I'm going to do head-to-toe visual, tactile assessment. So first, I will assess your olfactory nerve. So go ahead and close your eyes for me, and I'm going to have you smell this. Tell me what you smell.
Lavender.
Okay. And then, good job.
Thanks,
Cranial nerve number 2 is the Snellen, like the vision exam, which we already did with the history previously. And then cranial nerves 3, 4, and 6. I'm going to have you raise your eyebrows and follow my finger with your eyes. Good job. And then I'm going to assess Perla. So I'm going to shine my light in your eyes and look for the pupils to respond. And then I'm going to check accommodation. So look at my finger and then look up into the corner of the room. Okay, and so they accommodate, so that's good. And then cranial nerves 5 and 7 are, so I'm going to have you smile, show me your smile, frown, wrinkle your forehead, and then puff your cheeks out, and go ahead and open your mouth, and then bite down. Do you feel any pain in here?
Nope.
Okay, that is good. And then cranial nerve number 8 is hearing, so I'm going to whisper in your ear and then tell me what I said.
You said fork.
Yes, I did. And cranial nerve, so that was cranial nerve number 8. Cranial nerve nerves 9, 10, and 12. I'm going to have you stick your tongue out, move it side to side, and then say ah. And we'll check your gag reflex. And then I'll also do my oral mucosal assessment, check the color of the mucosa and such. And then I'm going to do cranial nerve number 11, which is have you straight your shoulders against my hands, and then move your head against my hand as well. Good job. So that's the cranial nerves. Next, I'm going to have you close your eyes. Well, actually, look at me first. Do this. You don't have to close your eyes right now. And then stand up. We'll begin the balance portion of our assessment. You probably can't even be seen in the video, but that's okay. Okay, close your eyes and hold your arms out to the side and alternate touching your fingers to your nose quickly. That's good. And then have you walk on your heels and then your toes. And then take one heel to your shin and move it up to your knee, back down, and do the same on the other side. Then I'm going to assess gait, so walk heel to toe in a straight line for me. I'm going to assess for scoliosis during that as well. Okay, and you can go ahead and sit back down. Now I'm going to start the head to toe assessment. So, I'm going to start with the head. I'm going to feel the skin. Is there any tenderness? Check for any lesions. Do you have any tenderness?
Nope.
Okay. I'm going to assess the ears with my otoscope that I don't own. I'm going to check the any malformations, and I'm going to assess the tympanic membranes. We already assessed hearing, and then I'm going to look in, so tip your head back and assess inside the nares. I'm looking for drainage, septal deviation, and then already did the mouth with our cranial nerves. So then I'm going to move to the neck and assess. And first I'm going to listen to the carotids for any bruits. So take a breath and hold it. Okay, you can let your breath go, and then I'm going to palpate the carotids as well. Okay, and palpate the lymph nodes. Is there any tenderness?
Nope.
Okay, good. Then I'm going to move to my thorax assessment. So first I'm going to palpate for fremitus. And say 99.
99.
Say it again.
99.
And again.
99.
And again.
99.
Okay. And I'm gonna listen to the lungs and all of the lobes. Take a breath here. 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 Last time. Okay. And then I'm going to listen to the heart and all 5 points of auscultation. So first is the aortic right here, and then pulmonic, and then herbs, the tricuspid, and then mitral. Okay, now we're going to move to an abdominal assessment, so you can go ahead and lay on your back for just a moment. So first I'll do a visual assessment. I'll check for any distension or asymmetry, and then I'm going to listen to each quadrant, listening for bell sounds or aortic bruits. So bowel sounds are active and I do not hear any bruits. And then I'm going to palpate via the abdomen. First, lightly. Do you feel any pain or tenderness?
Nope.
Okay, and then I'll palpate more deeply and feel for the spleen on the left side, and then over here on the right, come over here on the right side to assess the liver. That's it for the abdominal assessment, so you can go ahead and sit up now. Again. Then I'm going to assess the extremities. So, any lesions, discolorations. I'm going to feel your pulses first, your radial pulses. And then I'm going to have you squeeze my fingers a little tighter. Good, good. Let go. And then hold your hands out in front of you like that. Push against my hands and pull up against my hands. Good. I'll check cap refill. That looks great. And I'm going to assess the lower extremities. I'll do popliteal pulses. I'm going to assess for any edema in the ankles and palpate posttibial pulses. And dorsalis pedis pulses. And then I'll assess cap refill. I'm also assessing skin color and temperature. Okay, so that's that. And then I will do my assessment on deep tendon reflexes. So that would be the Achilles and patellar tendon reflexes and brachioradial reflexes, and then bicep and tricep reflexes with my little hammer. And that is the assessment. Thank you. Bye.